Welcome. We're glad that you're here. So thank you for being here. This event today will be about an hour long and will be an opportunity to engage with behavioral scientists at KU who have been working in different ways to help us better understand the effects of COVID-19 on human behavior in our region. My name is Emily Ryan. I am the director of the Commons at KU, and I have the honor of hosting this conversation with my colleagues across disciplines at the university. We are co-hosting this discussion today with the Institute for Policy and Social Research, which has done an incredible job of tracking the impact of COVID-19 on the state of Kansas and created a website with public access resources, which we will share a link to in the chat so that you can check that out if you want to. Part of the work of the Commons is to help make high-level research accessible to public audiences, and to do so in a cross-disciplinary context. Certainly, the pandemic has created a context with unique urgency and complexity that requires experts from many fields to respond so that we might better understand its many dimensions. Last spring, we hosted a conversation among 4 experts at KU, one of whom is joining us again today, who spoke about modeling in an effort to both help illuminate the work that mathematicians, biologists, and economists do regularly, and specifically to show how that work would be essential to our understanding of the virus and likely economic outcomes. Today, the conversation centers the work of behavioral scientists who study a range of topics and who have applied their individual knowledge to the work of better understanding COVID-19 and human responses to it. They are all contributing to the Faculty Advising on COVID team. So some topics that today's discussion will explore include trends in human behavior in the midst of natural disasters, what we learned about human behavior in the last year with COVID-19, both locally and globally, how policymaking can be responsive to prevent future problems of this scale, how restorative and compassionate approaches can be implemented, and how implications for the fall semester at KU may turn out based on data. So before I introduce my colleagues, I just want to share a few announcements for today's event. First, this presentation is being recorded and will be made available for viewing on the Commons YouTube channel once it has been edited and captions have been added. And speaking of captions, captioning for this event is provided by Caption Associates. So our thanks to them for providing added accessibility to today's event. To access captions, you can click on the CC button at the bottom of your screen and select Show Subtitles. And finally, please use the Q&A button next to that to share your questions for the panelists. After the panelists have each spoken, we will have some dedicated time for audience questions, so please share as you wish. And we won't say the names of those who have been asking questions, but rather we'll just read the questions themselves. So at this point, it is my honor to introduce our speakers today. They will each speak for about 8 minutes, after which we will take questions. So the first speaker today will be Ward Lyles, who's an associate professor in the School of Public Affairs and Administration at KU. His research interests focus on interactions of humans, natural environments, and built environments, with particular attention to increasing sustainability and compassion through decision-making. He explores local collaborative efforts to reduce risks from natural hazards and climate change impacts. He also represents the Center for Compassionate and Sustainable Communities at KU, a cross-disciplinary collaborative research and programming team of students, staff, and faculty. The next presenter will be Derek Reed, who is a professor in the Department of Applied Behavioral Science at the University of Kansas, where he directs the Applied Behavioral Economics Laboratory. Dr. Reed's research interests include behavioral economics, behavioral psychology, decision-making, and experimental analysis of behavior. He is a principal investigator at the Coffrin-Logan Center for Addiction Research and Treatment within the KU Lifespan Institute. His research program seeks to apply concepts and principles from behavioral economics to address issues of societal importance. And Derek will be followed today by Tim Pleskac, who is a professor of psychology, studying how people make judgments and decisions, how these processes shape behavior at the individual, group, and organizational levels, and how researchers can help people make better judgments and decisions. Dr. Pleskac investigates these questions with computational modeling and methods from the behavioral, cognitive, and neurosciences. At KU, Dr. Pleskac directs the KU Behavioral Science Laboratory in the Department of Psychology. And our final presenter today will be Donna Ginther, who is our returning panelist from last spring. And Donna is the Roy A. Roberts Distinguished Professor of Economics and Director of the Institute for Policy and Social Research at the University of Kansas, and a research associate at the National Bureau of Economic Research. Her major fields of study are scientific labor markets, gender differences in employment outcomes, wage inequality, scientific entrepreneurship, children's educational attainments, and child abuse and neglect. She's also the author and presenter of the majority of the videos shared on the IPSR resource site that we shared. We're really glad that you're all here today, and I will at this point turn it over to Ward Lyles to get us started.
Thank you, Emily. Thank you, everyone who is joining us for this conversation. I am loading up my slides now, and if somebody could just give me an audio that they're seeing the slides as we hope.
Yep.
Yes.
Wonderful, thank you. So to begin with, it's worth talking a little bit about why COVID requires the insights that come from social and behavioral science. And so if we think about other pandemics that we can face, you could think about a disease like cholera carried through the water. If we want to address cholera, then we need to make sure that the water that people drink, use for cooking, otherwise come in contact with is clean. That really is a problem that can be solved through a lot of engineering wastewater treatment processes. If we think about diseases that are borne by pests like mosquitoes, the vector of transmission is a living organism, then we need biologists. But when it comes to COVID, the way that the disease is spread is through the air, and we are the vehicles for transmission. And so we can't run all our air through pipes that we can clean like we can water, and we can't eliminate the pest because we are the pest. So for COVID management, we're fundamentally looking at a question of managing billions of individual and group decisions every day. As a scholar in the realm of disasters, we have 80 plus years of geography, psychology, sociology, and lots of other fields that have looked at disasters as a way to try to understand what happens when we're in crisis. One of the key lessons from disaster studies research is that disasters are fundamentally social phenomenon. Our social, economic, and political responses define whether it's a disaster or not. You can think about this in that tree falls in a wood kind of analogy, that if a hurricane's in the middle of the ocean, then we don't really worry too much about it because things we care about aren't impacted. Similarly, if a disease isn't impacting humans, then for the most part, that is not something of central consequence for us. What is important is thinking again about this individual and group decision-making. That's what decides at the end whether or not we make the decisions to keep people safe and healthy. So that raises local questions for us. One of the ones that's been really topical here is who gets to go back to school in person and when. We can talk about that some in the question and answer period. USD 497 has handled that differently than has private schools. Haskell has handled it differently than the University of Kansas. Which businesses are safe to reopen and under what conditions? What types of businesses, groceries, healthcare, bars, what are the distinctions there? These are social decisions, political decisions, economic decisions. Another big lessons from disaster studies is that disasters present political crises and opportunities. So the federal failure created a crisis that state and local governments had to fill in the gaps. This is largely similar to the problems that we face as climate change. And that's one of the reasons I got into looking at COVID, is because COVID is very similar in terms of the problems it presents and the solutions that are being innovated at the local and state levels in the face of large spread federal failure. In a capitalist system like the one that we live in, disasters can be exploited to make money, plain and simple. We've seen that with the actions of some US senators who pivoted their investment portfolio early in the pandemic to make money. Lots of other people are thinking of ways, how can I make money out of disasters? That raises local questions in terms of who made decisions and who is held accountable. When we're thinking about who is going to face the fallout from the political crisis and who's going to take advantage of opportunities. And then how do on-the-ground leaders make up for higher level leadership failures? So people that are leading KU are on the ground relative to federal government, and people in departments or even students are on the ground relative to the higher level leadership within the university. Lesson 3, disasters generate psychological challenges. The uncertainty that comes with the disaster and the disruption are things that are uncomfortable for most of us. And we want to get back to normal. That is one of the things that we see over and over again in disaster studies. We want to get back to normal. You see these news things from just the last few days. How many times have we heard Dr. Fauci and others say, well, okay, we got to be careful. We can't get back to normal quite yet. That's a natural tendency, but it's one that often gets us right back into the problems that we started with. Massive mental health impacts that are underaddressed. When we think about the levels of trauma from the subtle to the acute, these are things that are hard to see, but have major impacts. So that raises local questions again. Can we offer a normal college experience in a pandemic? Can we get back to normal? And what is normal? What worked well about normal and what didn't? Can our mental health system handle the challenges that persist? It's easy to see when we add plexiglass. It's harder to see when we provide care in our systems. Lesson 4, disasters reveal underlying system failures. This is one of the most uniform lessons. You can think about healthcare. COVID has shown the ways that our healthcare system works and does not work, for whom it works, for whom it does not work. We've seen burnout with staffing, people who have access to insurance, even trust based on who's going to take the vaccine or not. These are all ways that our systems that we've lived with are exposed to work or not. Generally speaking, in disasters, when we have extractive capitalism that treats land and people like things to extract wealth from, that shows up during disasters. So too does racism and other forms of oppression, wealth inequality, and privilege. So we've seen that with disparate impacts of COVID in terms of who's been infected and who's had catastrophic outcomes. In terms of local questions, again, we could think about the question of how can it be that college students are out partying in relatively normal ways while elementary school kids can't go to school, and while people of color die at disproportionate rates? That's an underlying evidence to different layers of system failures. Why within a university are GTAs who are paid the least and are most likely to lose their jobs in an economic downturn the ones that are most likely to be teaching in person? These are equity issues and system failures. Leadership matters. This is a huge lesson in disaster studies. And you need networks of trust and cooperation. And so at the federal level, we saw leaders who tried to try to diminish trust, really, and inhibited cooperation. That led to other people having to fill in the gaps. Relationships matter. When you have lots of turnover in a network or lots of distrust, you're not going to be able to have the leadership you need to be effective. So in terms of local questions, this raises ones about why are business groups, the Chamber of Commerce, why were they involved in the Unified Command from the beginning, but not groups focused on social services and equity? It was because economic interests were placed above in the discussion concerns about the well-being of our most vulnerable citizens is one interpretation. And then what are the consequences here at KU of having the leadership team, the medical advisory team that had high preponderance of medical and logistics experts, mostly white males, and not social and behavioral scientists or folks that have an inherent focus on equity? That leads to a decision-making, perhaps a lack of perspective. So those are 5 lessons from disaster studies, cover a lot of ground really quickly. I'm gonna just try to go through a couple more points. One is that there's evidence that's compiled from CDC studies in January. There was another study that came out in the economics literature just today that has shown that in places that had higher ed with in-person learning, that there were increases in COVID soon after the opening. Was this because we had more testing? Was it because we had more on-campus activities? Was it due to off-campus activities? I think, as we'll see in our data here in Douglas County, that the real challenge for us here has been with not what's happened on campus, but what's happened just off campus. So here's a little bit of data on cases that have case data throughout the fall, from this time last year all the way to the end of the fall. The 18 to 24-year-old age ranges, the blue line there, all other age ranges are the other colors. Bars reopened and we saw an immediate spike that was identified and linked to the Jayhawk Cafe, Bullwinkles, and Wagon Wheel, the so-called Bermuda Triangle down around 14th in Ohio. There was an outbreak. The bars were closed and the case numbers immediately lulled thereafter. Meanwhile, none of the other age groups were seeing an increase in cases. It's notable that there were no deaths in Douglas County before this bar reopening. Granted, KU was not in session here. When we look after that, we see the entry testing of KU. Clearly, some of the rise in cases is because we were doing a lot of testing, but at that same time, classes began, so the spike happened before classes began. We don't point to classes as the point of transmission, but there were lots of very visible parties in our off-campus area. The bars reopened then in October, and it was not the same immediate spike in terms of cases. One thing we'll see, we'll be able to elaborate on this as we go into our other presentations that relate to our FACT activities, observational studies, survey data, and broader data. So that's longer than I was supposed to go, but a quick spin through some data, and I believe I turn it over now to Derek.
Thank you, Ward, for introducing some of these ideas. So my goal here in the short time that I have is to share with you some of the research we've been doing related to direct observations of mask wearing on campus, as this is a primary measure of what we could do to mitigate the spread of COVID-19. Before I go too much further, I do want to acknowledge the following people for all the help that they've provided in collecting these data and supporting this research. Several of these individuals are on this call, and I really appreciate their help. So this probably isn't news to anyone on this call, but masks significantly prevent transmission. There's very clear evidence from natural experiments, as well as some medical research, as well as some local research within Kansas on the spread of COVID-19 related to mask mandates and the use of masks. So we've heard about this. I don't need to convince any of you that masks are important. Masks, along with social distancing, are the best things we can do behaviorally to stop the spread. So the university quickly transitioned into creating some policies to help protect us using what we knew at the time. So the University of Kansas has a policy that requires everyone on campus to wear a face covering at all times while on campus. So the expectation is that while we're in classrooms, face coverings, masks, etc., it can only be removed for brief periods of time for the purpose of eating or drinking, except while in classrooms, those have to be there. And so the issue then becomes, is this happening? And if so, where is this happening and what can we learn from it? So one of the things that we did in collaboration with Tim, who you'll be hearing from next, is a campus-wide survey back in early December. And over 2,500 responses, we had students respond to a question that asked them to think about what they've observed on campus during the day hours. In the 2 weeks before Thanksgiving, we instructed students to click on the areas where they saw the least amount of mask wearing during those days and times, and they were allowed to click up to 5 spaces. Where they clicked generated these heat maps that we are presenting to you on the screen now. We targeted areas on main campus, as well as some areas to the west of campus where some of the residence halls are, as well as some of the neighborhoods immediately to the east of campus. Some of the things that are noteworthy is that on main campus, where you see things lighting up in terms of the heat map, those are also the areas where you expect the most foot traffic on campus. So it's not too surprising that where we're seeing the most amount of mask violations is also happening where there's the most number of students. And I'll return to that in a moment. On the right side of this slide, you'll also see some areas to the east of campus, and particularly 3 bars that Ward just discussed were selected by a good number of students, which is related to the size of those heat maps. What you'll also notice is that fraternities, relatively more than sororities, were also endorsed as areas where there was fewer instances of mask wearing. If you squint very closely at your screen, you'll also see that there are various buildings and spots around campus on that, that right screen, that right portion of the slide, where you'll see people endorsing. So there's some light blue fading, and some of those are honors halls as well as like apartment complexes. So group housing in that right image isn't necessarily where you're seeing the most amount of mask violations. It's fraternities and sororities, unfortunately. So what we did with this information that we obtained from over 2,500 undergraduates was we had some trained observers go to some of the areas on campus and do some direct observation in the past fall. And so what they did was recorded for about half an hour and counted the number of mask violations that they observed, and those numbers are in black. If you can't read it, it's not really necessary. The highest numbers were associated with the student union and the rec center, which again is what you'd expect given where students are going. So this encouraged us to take a stronger approach to measuring these data. And so what I've done, along with collaboration of a couple other labs, is mobilized a team of researchers, including some undergraduate students in my lab, to go on campus and try to get as much data as we could on mask wearing. So currently we have 12 trained observers who are trained in applied behavioral science, and they've conducted 56 sessions of observations to this point. So they've been working very hard, getting course credit and working with my lab. Across these 56 observations, that we've had 4,522 campus students observed during this time frame. And just before we get into the data, I wanted to share with you that in terms of data quality, we've had about 20% of our observations featuring a second observer independently recording to ensure that we're getting reliable data. It's about 97% accuracy between the two observers. So on to the data. So these are some of the areas that we've focused, and on the right, I think is the most important point. That is the percentage of safe mask wearing by location. And it's encouraging to see that some popular areas where there's high concentration of students, like the Burrs Union, Wesco, Student Union, those are pretty high in terms of percentage. But we do see that there are some areas where it's relatively low. So Capitol Federal Hall, the Rec Center, and Jayhawk Boulevard Budig Bus Stop. And so these might be areas to target for some signage, some messaging, more efforts on the part of the university to try to encourage mask wearing. And recently, there's been some data coming in to suggest that, especially at buildings like Capitol Federal Hall, we're seeing students go into the buildings wearing masks and leave without them. So I'm not quite sure what's happening there. So that's another research question that we have to uncover. But it does suggest that perhaps there's some peer pressure to remove the mask when you're around your classmates who are not wearing masks. Over time, we've taken data to see whether or not this has evolved. And what we're seeing is that there has been a little bit of slippage in the very recent weeks, which is a little bit concerning given that we have the variants coming and people are already relaxing social distancing because of some false sense of security given the vaccine. So this is something we're monitoring very closely. So I want to wrap up with a couple of main points here. Number one, I was somewhat hesitant to even share these data because there's a known phenomenon called the boomerang effect, where when you talk about people violating norms, then it encourages other people to do it because it makes it seem like that's acceptable. So I want to reiterate, the overwhelming majority of KU students are appropriately wearing masks on campus. So we're seeing, upwards of 80, 90% mask wearing compliance, which is fantastic. So this research is really helping us here at the University of Kansas understand perhaps where we should focus our efforts, as well as the demographics associated with people who are being a little bit more risky. But there's also some broader reach that we've had with this. So this work was initially developed by my team and some others in the University of Kansas Department of Applied Behavioral Science, working with the WHO. And so some researchers in Africa were interested in collecting data on mask wearing. So this was developed by them. Since then, we've been training some other scientists in Brazil to address their crisis with the rapid spread of the variants. And so hopefully these direct observation techniques will be helpful there as well. We've also secured relationships with other similar institutions to replicate our findings. So that'll be interesting to see how KU compares over time. And we're developing some open source training packages for wider dissemination. Ultimately, this research will provide higher resolution analyses looking at things like correlates with weather, as well as some demographic information. So stay tuned for that. So what's next with this work? Well, I think that this suggests the need to encourage people to stay vigilant with mask wearing. We're seeing some slippage, which isn't good. So we need to remind people that the norm is that people are wearing masks, and you don't want to deviate from that. In addition, we need to provide access to masks if necessary. I don't think access is necessarily the problem, but perhaps within buildings, there needs to be some effort to have access to free masks. So at least professors, if they see students violating the policy, can use that as an opportunity rather than punishing mask compliance issues. They can use this as a prompt to remind people that they should be wearing a mask by offering a free mask. So again, remind everyone the norm is mask wearing, and we should not be focusing on the numbers of violations necessarily, because we don't want to make it seem like everyone else is giving up on this. So why should I, as another student, care? We need to focus on the people that are doing the right thing to try to encourage those social norms. And then using that information, we can create some behavioral interventions to nudge mask wearing, maybe create creative ways to produce social pressures and to encourage responsibility for your campus community. Well, thank you very much. I will turn things over now to Tim.
Thanks, Derek. So this work dovetails nicely with what Derek just presented. And I should mention this is a joint work with Derek Reed, James Adiaka, which is he was a graduate student in my lab, as well as the rest of my lab. I don't know if, I'm sure many of you would maybe kind of agree with me that in some ways you could think of this past year as kind of like a giant fog that kind of fell over us, right? There's a fog of uncertainty that embraced us in all areas. You know, there was uncertainty about what the virus was like. There's uncertainty about what people were going to do. There was uncertainty about how our systems were going to work. And in some ways, there was just a big fog that embraced us. And that actually, this quote, which is probably now overused, but always resonates with me when I think about this, from Donald Rumsfeld, where he said, in a different context, but there are known knowns. We also know that there are known unknowns, but there are also unknown unknowns. And if one looks throughout the history of our country, in other free countries, it is the latter category that tends to be the difficult ones. And I think that should resonate strongly with all of us, right? The amount of unknown unknowns we've faced over the past year, trying to figure out how and what to do. And so in some ways, I thought about science as a really important tool in the past year to really help make known those unknown unknowns, right? And so it's been really impressive. And I always, there's this saying talking about, we can make a vaccine, but we're having a hard time getting people to wear masks, right? And so that raises questions like how often are people wearing masks? And Derek just walked you through a way he's been doing it to ask direct observation. And so what I'm going to do now is, try to fill in some more aspects of this uncertainty. So as Derek mentioned, we surveyed 165 volunteers from the KU psychology pool, and then later 2,759 undergraduate students from KU. And one of the places we were curious on is we asked them, when you were on campus within the past 2 weeks, what percentage of the time did you wear a mask? We timed this with Derek's direct observation because we wanted to kind of self-validate. We also asked them on any given day within the past 2 weeks, what percentage of the time do you think others wore a mask? And so here's the results we have. This is summarized. And so just like what Derek showed, he did direct observation across a range of locations. And we asked people those same questions for all the locations shown. So what you can see is the locations are on the x-axis, mask wearing rate percentages, both either the direct observation, which is the actual rate, and then the estimated rate by students. The blue bars are what you saw in a way with what Derek presented, showing you about a high rate, about 90% at that time. The purplish bars are the self-reported likelihoods, right? So they're a little bit lower than the direct observation. So people are a little bit less extreme. And also, what's also interesting is the green bar, which is the percentage of what others are wearing, right? So we're seeing, in general, as Derek just presented, a high rate of mask wearing. We're also seeing some differences between what you think yourself are doing and what others are doing. And this is actually accentuated when we did a larger sample with the 2,759. This is the estimate of mask wearing across campus. We also did it off campus. It's kind of the same effect. But you can see we have a larger sample. The self-reports and the direct observations track each other quite well, right around 90%. There's a 10% difference between what you think you're doing and what you think others are doing. And I think that's an interesting aspect. Again, it goes to what Derek was pointing out. There's a norm, right? We're all wearing it. But we tend to kind of think others aren't doing it as much as we are. So there's a discrepancy there. Now, the direct observation says it's actually the case that you're doing it, you're better calibrated than what you think others are doing. So another place where we've been working to make known the unknowns, right, is will students get vaccinated? And that's probably maybe the big question we're all thinking about and kind of going through. So in this time, just to give you a time, we asked these set of questions between December 14th and December 24th. And we asked students, how likely are you to take an FDA-approved COVID-19 vaccine? And we did the same thing. How likely do you think the typical undergraduate student is to take an FDA-approved COVID-19 vaccine? This was just to remind yourself. This was right. It was right at the time when it was about the first two vaccines were going to get FDA approved. So it's right in that ballpark. Now this is a slightly different where I'm not looking at the averages. The top plot shows you the distribution of the likelihoods that people reported. Okay, so the top one is how likely are you to get a COVID-19 vaccine, and it shows you a very skewed distribution. Right? It shows you that people are over 50% are certain or near certain that they're going to get a COVID vaccine, right? But then you can also see, if you look at the bottom panel, that gap appears again between self and other, where you're more skeptical about what others are going to do. So there you can see almost, in this case, a 26% drop in terms of what you think others are going to do. We don't know necessarily the right answer, but if we were betting off the mask, maybe it's a little bit more calibrated what you think you're going to do. And that has, again, important implications, again, of thinking about the norms that we're communicating. We also looked at individual differences. This is a slide that has a lot of information all at once, but these are correlations. And what you can see is we looked at like different behaviors: campus masks, Lawrence mask wearing, vaccine likelihood. We also took the difference between self and other, and if they've had COVID, and if people reported having COVID-19. And then we have a set of individual differences: political orientation, numeracy, discounting, and risk propensity. I won't spend a lot of time, but I think this is pretty interesting. One of the things that is striking is political orientation is strongly correlated with these behaviors. This is, so for example, vaccine likelihood is -0.45 correlation. So the more right-leaning, the less likely people would be to report an intention to get the vaccine. You'll also notice something that's interesting here also with vaccine likelihood. That's the difference between self and other. That's an interesting aspect in that there's a correlation in that the more right-leaning a student reported being, in effect, the more correlated they are between self and other. So there's some ways to think about that. One thing might be that a more left-oriented student is looking at the more right-oriented students' behavior, and the more right-oriented students are looking at the right-oriented students. We don't know that, but that's at least one possible interpretation. My lab, we've also been thinking about it in a slightly different aspect also. As we kind of, can we find a way out of this uncertainty? And there's always the quote by Yogi Berra, it's it's tough to make predictions, especially about the future. And I think that's also something that's been really highlighted by the pandemic we've all been in, is that we really have this desire and this need to basically even predict. We're having a really hard time doing now forecasting, let alone predict into the future. And so one of the things my lab and I, and James and I and my lab have been doing, is thinking about the way we could tap the wisdom of the crowd. In this case, the wisdom of the KU crowd, right, to inform us and make predictions. And so there's, I'll just kind of go through. You can think about, how can I tap the wisdom of the crowd to make predictions about what's going to happen? So there's different algorithms you could develop. One of them is just simply average, right? We know actually from a lot of work in behavioral economics, you can average across the predictions of n individuals, and then that would give you average, and that would give you a good prediction. You can do confidence-based weighting, so we get the confidence people give, and then predict those estimates. Numeracy-based averaging, we can get a numeracy score of each individual and basically weight their prediction by the numeracy. And then there's another algorithm, which I don't have time to go through, which is surprisingly popular, where we essentially ask people, what do you think the right answer is? And what do you think the popular answer will be? And it turns out the answer that maximizes the average difference between the right answer and the popular answer is the surprisingly popular answer. So we've been essentially competing and asking which of these algorithms is going to do better at predicting. So this is, and then at the same time asking, well, what size of a crowd should I do? Should I sample 2 people? Should I sample 10 people? Should I sample all 165 people that we sampled? And so this just shows you on the x-axis is crowd size of different samples. Y-axis is the percentage of mask wearing estimates. The red bar is what we saw from Derek. And what you can see is we can predict, you can see what you'd expect, right? As crowd size gets bigger, there's less and less variability around the predictions, but you can also see that bias that creeps in, right? That people underestimate how often they're going to wear a mask. We can correct for that via what's called extremizing, so we can calibrate that, right? And so when we do that, we get a really good prediction out of sample. And so to kind of give you food for thought, we can do that for example, vaccine predictions. So again, it's tough to make predictions, especially about the future, but here we can use wisdom of the crowd to make a prediction about the likelihood of students to get a vaccine. And so out of these algorithms, you can get about an 80 to 90% chance. And I think that's a very positive looking aspect, but that's our predictions. So just to summarize, mask wearing is high on campus. People tend to underestimate how much others are wearing masks. A majority of students report near certainty that they will get a vaccine, but they are also a bit more skeptical that others will. Political orientation, numeracy, and patience are correlates of the likelihood to mask up and intent to vaccinate. I think that's new results that we haven't been able to really get at with these individual differences. And we can tap the wisdom of the KU crowd to predict behavior and help tame uncertainty. And I think that's a really interesting aspect, an insight that we can provide from the social and behavioral sciences about different ways to get predictions. I'll just leave you with this idea that I've been also thinking about. The poet John Keats was asked, what makes these authors like Shakespeare really good? And he coined this term called negative capability. And what is a way to think about it is it's a writer's ability, which Shakespeare possessed, according to Keats, possessed so enormously, to accept uncertainties, mysteries, doubts, without any irritable reaching after fact and reason. So I think this negative capability is something that a lot of us have, right? It's that ability to survive and thrive in uncertainty. And I guess I would remind us, uncertainty is kind of the human condition. It might seem new, but we've all developed tools and mechanisms to deal with it. We just have to learn how to use them in the particular situation that we're facing. So I hope that gives you a forward facing thing. So with that, I'm going to just acknowledge and thank Donna Ginther, Board Lyles, and the members of FAC, as well as support from the IPSR and funding from the University of Kansas Office of Research. And I'll turn it over to Donna now.
Thank you so much, Tim and Derek and Ward. I'm gonna share my screen. And here is our sort of work that we've done at IPSR, partly. I'm going to provide some analysis that Carlos Zambrana at IPSR and I have done on the impact of mask mandates in Kansas. We've also, Pat Osland and I looked at estimates of the characteristics associated with prevalence testing and testing positive. And I'm here to tell you it ain't over till it's over, and it ain't over yet. You'll know what I mean when I get there. Anyway, so the question is, do masks work? And the answer is yes. This is joint work with Carlos Zambrana. As you know, in the state of Kansas on July 3rd, the governor announced a mask mandate. The dark teal colored counties said yes. The lighter teal counties said yes late. And then there were partial enforcement where the cities said yes, but the county said no. So this wasn't adopted uniformly across the state. So this gave us random variation in who was asked to wear a mask mandate. So we looked at the data. And so we started actually looking at the data in August, and you'll see that cases were higher and they were about parallel to what you would expect in mask and non-mask counties. Here's where the date was imposed, and we started measuring the difference afterwards. But something happened in September. Cases in the non-mask counties zoomed up, and cases in the mask counties leveled off. Everything started increasing in November and peaked, and then all of the cases converged by December 16th. And on November 25th, the governor said, we have another mask mandate, and many of the non-mask counties adopted. So that's when our experiment ended. So we looked at hospitalization rates as well, and you see that, you know, hospitalization rates were tracking each other through October, and then a huge divergence, increased hospitalizations in people living in non-mask counties. You see this somewhat in deaths. There's a difference starting in November in deaths, but it doesn't look as dramatic in deaths. So we used a difference in differences methodology where we measured average number of cases per day in counties with and without a mask mandate. So negative numbers are good, which means that there's a reduction in cases per day. We did control for social distancing behavior, but I'm not going to show that to you. And basically, we show that with our differences with our estimation sample, those are the counties that took the mask mandate in July, had 16.5 fewer cases per day. If we add in counties where the city had it, but the county did it, the numbers go down. If we had counties that didn't enforce the mask mandate, it looked pretty similar. And if we added late adopters, it went lower. So we show evidence of about a 44% reduction in cases per day. And then we looked at hospitalizations. Now, hospitalizations are less frequent, but we get about 0.6 to 0.75 fewer daily hospitalizations. Our average number of hospitalizations per day is not reported in this table, but if you take it relative to the average, oh yeah, here it is, 1.3. So we have about 1.3, and we reduce that in mask-wearing counties by 0.66. So that's a 48 to 56% reduction. And you see this across all the rest of the counties. And then finally with deaths, the evidence is not as strong. We see that, we had an average of about 0.08 deaths 0.43 deaths per day in all of our time period, but we see a reduction in the estimation sample, including lagged cases, of about 0.19 or 0.21. This is only significant at the 10% level. It's weaker than what we might hope, but it's still a sizable reduction. So we have counties in Kansas with a mask mandate are seeing between 33 to 44% fewer cases. And we estimate that mask mandates were associated with about 35,000 total fewer cases between July and December. We estimate 48 to 56% fewer daily hospitalizations. That's about 1,500 people fewer going to the hospital. And then we estimated about a 64% reduction in deaths. That's with new data that I don't have the table for you here, but that's about 500 fewer deaths in counties that had a mask mandate. So one of the things we looked at, and this kind of accords with what Derek, Tim, and Ward were doing, we're looking at the determinants of prevalence testing at KU. And these are characteristics of students, and we matched them up to whether or not they tested positive. And you see that Greek members under the age of 21, Native American students, sophomores and juniors relative to seniors, are significantly more likely to test positive. We also found that younger male students who are members of Greek organizations are less likely to comply with testing. So women are less likely to test positive, men are more likely, and there are also, women are more likely to show up for the prevalence test. I've had a conversation with Andrew Foster, who runs our prevalence testing on campus, and he's having a heck of a time getting people to show up for testing. And more on that in a couple of slides. And this is what Ward showed, but this is us looking at, these are counties. Red is without a mask mandate, and blue is Douglas County, University of Kansas, and red is the start date. And you see this spike in cases because we were doing entry testing. And then our cases start going up in November. You see a similar pattern in Riley County, in Crawford County, and in Ellis County. So after college started, after classes started in the fall, you see a spike in cases in those counties, in most of those counties. And that's an increase relative to counties without a mask mandate. So my punchline, my takeaway point is that we need to remain vigilant. So this is data that IPSR helps Belinda Sturm with. She tests the wastewater. And here's the level of COVID in the wastewater. And here are the case rates. And she, using these methods, looking at the wastewater, you get like a 7-day earlier estimate of actual cases. So you see that cases kind of trended down in the Wakarusa watershed, and you see that reflected in cases, and you see it going up, reflected in cases here. But you see, starting this year in February, March, there's a big disconnect between the level of COVID in the wastewater and the cases that we're seeing. And this is because people across the country and in Douglas County and at KU are not getting tested. So we don't know what we don't know about the number of cases out there. So that's something we need to think about moving forward as we think about COVID on campus.
Thank you very much, Donna, and thank you, Tim, Derek, and Ward. We do have a couple of minutes for questions. If you would like to submit, this is a reminder that there is the Q&A to speech bubbles down below, and you can click that to submit a question. I did want to ask one question while people are formulating their ideas for them, which is, what is the process of affecting policy, both in terms of the debates and the discussion that is happening, but also in terms of actual written policy? If there's a way to answer this from any of your perspectives, but also just sort of in an overview for those of us who don't already know this.
You want to go first, Ward?
I was gonna say, Donna, you should go first because you were on Rachel Maddow and you have the content, like what you were talking about was so topical in terms of the mask mandate at the broadest levels. I can talk a little more locally, but yeah.
Okay, so What happened with the mask mandate was, I directed the Institute for Policy and Social Research. We had a conference in October. Carlos and I started looking at this about a month after the mask mandate, and we found nothing. So we're like, we're not seeing anything masks working. And we presented it to our colleagues at the Med Center, and the Med Center is like, you're wrong, masks work. They were really angry at us. And I'm like, well, they're not working yet. But anyway, so we said, okay, we'll hold off. And then in October, early October, we looked at it again, and lo and behold, they were working. The numbers changed, and we saw the data. And so we had this conference on October 22nd, and I thought it would be useful to share this information. We had about 200 people who registered, and thought, well, this is relevant. Counties were debating whether or not to have mask mandate. It was very controversial. The mayor of Wichita, somebody tried to, was planning to kill him over having a mask mandate. I thought, it's really relevant for the state. We'll have this, presented it. And then it got picked up. The Lawrence Journal World wrote a wonderful article about it that got picked up by the New York Times, and the New York Times article got picked up by Rachel Maddow. So, I just wanted to let people, policymakers in the state know, but it kind of went national. So that was accidental. But, I think it's important if you find something, this is a health policy thing. Think about wearing a mask. There's no downside to wearing a mask, right? You're not going to harm yourself. Some drugs you take can harm you, right? But a mask is not going to harm you, right? So the downside to a mask is bad. If you can demonstrate an upside, giving people that information is important for public health.
Yeah, and I'll piggyback on that. And I think that, being in a school of public affairs and administration, I was a lobbyist before I came back to do my PhD. So thinking about the interplay between the work that we're doing and how it can influence decision-making is central. As an academic question and also a lived question. And at that conference that Donna and IPSR convened, I was on a panel with Dr. Lee Norman, the health secretary for the state of Kansas, one of these people who's getting death threats. And Kansas has had a hemorrhaging of public health officials because this has been so toxic for them. But it was interesting because in that conversation, I was making the point, we didn't have all this data that we've done, but making the point that throughout disaster science, that these are social behavioral problems, and that we're not at the national level at that point, at the state level, even at KU and local level, we just weren't paying enough attention to social and behavioral wisdom. The kind of stuff that at a more granular level that Derek and Tim and others generate. And he took that to heart and invited Vincent Francisco, who will be speaking next week, and I believe was here or is here. And I had a talk with him, and then we talked also with some folks in the governor's office, and trying to deal with this vexing problem of the fact that COVID was hyper politicized and has remained so, down to the point that mask wearing, in the world I live in and thinking about floods, there is a cost if I say we shouldn't develop in the floodplain because somebody can't make money off of developing it. There's a trade-off, and the debate is about private property as a freedom, as opposed to here we're like the freedom to not mask or the freedom to go out and party when I don't. Like the sacrifice of partying in a group of 8 is very minimal, but the bars want to be open and these pressures. The thing that I'll say in terms of local stuff is there was, this is the balance between being an on-campus, like doing my research, and being a neighbor is, I took video back in the fall of one of the parties that was across the street from the football stadium, and it went viral on social media and ended up with millions of views by the time it got on TV. What it showed was that there was a system failure. There was a party that was off campus. It wasn't KU. KU couldn't regulate it. The police couldn't do anything because it was a public health order, and the public health department is closed on Saturday night. But that then complementing with, that was able to do that because of the kind of research we've been doing the mask observation, these things, and seeing that there's a gap in the story that's being told, the narrative that's being told that, hey, we're doing a great job. Well, we're doing a great job in some places and really failing in others.
Thank you. And people are asking great questions also, which are Tim and Donna both have answered in the chat. So that's also really helpful. And just in the interest of time, I maybe won't read those, but you can see them there. Unless Tim or Donna, do you want to call out either of the things that you've just responded to?
I can say something about one. There was a question about how we asked the question about other, and that question was about other KU students, which is an interesting aspect that we're still seeing that difference between self and other. Now, it might be that we actually aren't controlling for the similarity still, right? That could be, for example, I think that's part of what the political orientation might be picking up. And so I think that's a really fascinating aspect that we haven't really uncovered. And the other question was about the algorithms. And we really did a horse race. And one thing I didn't mention was like, it doesn't seem, the best one is like a weighted by confidence is the best algorithm that we'd be using. So we sample, say 50 people, and that should give us our best predictions.
So I take away from Tim's presentation that vaccine uptake among our students will be really high. And I find a lot of confidence in that. I also noted how politicized his data was showing. And that's been a huge problem.
Yeah, I mean, in psychology, we were used to seeing like correlations of 0.3, right? That's like, ooh, and it's like, holy cow, we're like, I mean, it's a big correlation. And I wasn't really expecting that. And so and those hold up in regressions. I didn't show you all those regressions. The regressions hold up. And so that's really interesting, kind of worrisome. I mean, it's worrisome. There's a lot of stuff coming out on the polarization, and you can see it in our student body. And I think we actually need to think about how we deal with that and how we work together to kind of understand our different perspectives.
And I think it's a larger issue for the state, right? Douglas County, Lawrence is a little blue dot in a sea of not blue, right? A very red politics. And so, you know, how we take public health away from these polarizing issues, I think, is really important going forward.
Well, and Donna, to that point, I think it'd be interesting. We're a blue dot, but we're a blue dot that pulls people from throughout the state. And so when we think about this, it'd be interesting across our testing data with some of these, if we know people's home address or home zip codes, and begin to understand what political environments they may be more or less likely to be coming from. One of the things to the question Rhonda asked, I didn't get a chance to go into it, but there are folks that have done big national studies, and what they found is essentially to the large public universities and the handful of large private universities were the ones where they saw these COVID spikes when they went in person. And there haven't been massive national stories. I mean, there have been some dorm outbreaks, but even this spring, Johns Hopkins and Duke, two private universities, have both gotten attention because they've had outbreaks. They were really much more aggressive in how they responded to it than a lot of public universities have been. But even those places, these outbreaks are being seeded mainly by the party scene and folks congregating and singing and partying and likely without masks. It's not happening through the classrooms. And for big public universities, one of the challenges is that stuff happens off campus. And so when we think about policy levers, if the city doesn't want to be in the business of breaking up house parties and sending, I mean, I've talked to the police here, we were running for a while at 2/3 of our police capacity. So you can't risk sending a police officer in to break up a party, and that police officer gets COVID or has to be quarantined. And so again, we're looking at a system failure, and the university doesn't either have or isn't willing to execute the powers. I mean, Duke and Johns Hopkins, they'll suspend people or expel them if they're not compliant, but that's because a lot of their stuff is happening on campus and they have different codes of conduct. So there are these interplays of the politics and the location. As a planner, I'm always thinking about space. So what's happening on and off campus are intertwined, but really different on who can affect the behaviors.
Thank you. I think
And
I might,
Emporia State doesn't. Emporia State, Hayes State, that's not the dynamic at those places. It's the big public universities with big time sports and big time Greek life scenes that seem to be the variable.
thank you. I think I might pitch this last question to Derek. You talked a lot about your students' involvement in terms of collecting data and gathering, and recognizing that a lot of the people they were collecting data on were their peers effectively. I wonder if you'd be willing to share what that experience was like for them, or what kind of maybe things that might have surprised them. I know a lot of the data you shared, you said weren't super surprising in terms of locations and that kind of thing, but other feedback.
Sure. Yeah. So one of the things we've routinely discussed is how to be as discreet as possible and make it not seem like you're collecting data, because we don't want reactivity and people realizing what's happening. But you see someone standing with a clipboard making notes about people walking out of a room, people might be able to figure out what's going on. But I think the reality is most students aren't paying attention enough to even detect that that's happening. There have been some weird interactions that have happened with students, and they've had to navigate that in terms of people approaching them for various other things, because they're sitting there kind of as just passive observers. And so there hasn't really been any negative reactions from anyone about what they're doing, but I think it's simply because they're blending in as well as possible. So that's a challenge.
I would also, you have another part. With our survey, there was one thing I was going to say. With a number of times in our comments and our surveys that we collected, students thanked us for asking for their input, and that was really striking. Very rarely do you get thanked for surveying people, but in this case we did. So I think that was another aspect.
And I think most students on campus are very much compliant. They want to see everything return to normal by doing the right thing. It's a small number of people who are creating a lot of the problems. And so I don't want to lose sight of that most of our students are really doing the right thing, and really appreciating, like Tim said, that there's a group of faculty here who are taking this seriously and investing our expertise and resources in helping.
Awesome. Well, thank you so much for sharing that. And I guess we're at time, but I did want to just make a quick plug for the second event in this, series of discussions. So next week at the same time, March 25th at 4 p.m., we will have a conversation that will actually feature some student perspectives. Here, I'll show a quick graphic so you can see that. Some student perspectives, because they have been involved in the research as well, with Vincent Francisco, who was just mentioned by Ward. So please feel free to come back and join us next week. I wanted to say thank you to all of our panelists today, and for the research, and also for just being willing to share it with all of us. So have a great day, and we'll see you next week.
Thanks, Emily.